Hi, I'd like to talk to you today about a new mobile pain treatment program for peripheral neuropathy pain now available in the state of Louisiana. So I wanted to chat with you a little bit about what this is. Most of you watching this are familiar with neuropathy pain, or you probably have it if you're watching this. Burning, burning pain, numbness, tingling, all those things. And like you probably do already understand, it's a very difficult condition to treat. Most pain doctors and internal med, family practice, a lot of these doctors, they don't have really many options for this, right? This is one of those things where it's basically going to be some medications and prescriptions, and that's about it. And there's not a whole lot they can do. And so a lot of patients end up on medications for years and years and or decades. And I've met hundreds of patients where these meds have just worn off. There's just nothing that works for it anymore. Uh, Again, met plenty of patients that had neuropathy going on, for decades and just dealing with it, right? So why the mobile program? And I'll tell you what the actual treatment is here. It is called neurofunctional pain management and that's what we're doing on site in your home. And so as a mobile program, one of the things that I noticed is that patients had a hard time just even getting to the office for a treatment. So when we used to put these programs in doctors' offices, the patients would have to come into the office on a regular basis to have this treatment done. And I'll explain kind of how it all works in a minute here. But just that aspect of dealing with the office and the travel back and forth from home is just very difficult and it's painful, right? And patients had a hard time with it. So converting it to a mobile program is the only way to really get to everyone who needs this, right? Neurofunctional pain management. It's a combination therapy that I developed back in 2018. It consists of three categories: electroanalgesic therapy, IV hydration nutrition therapy, and health coaching. So electroanalgesic therapy. You probably never heard of it. Never heard of neurofunctional pain management or electroanalgesic therapy, but electroanalgesic therapy is a high pulse electrical current. It has been in the market for nearly 40 years. It is not something that's brand new. It's very well known, very well understood in certain areas of the medical industry. It's known, it's understood, it's accepted, it's proven itself over the years, and that's to our advantage. We're not trying to do something brand new here that no one knows if it works or not. Everybody who uses this and has used it in the past, they know that it works. But there's a reason why you've never heard of it and why you've never seen it. And there's also a reason why most doctors out there have never heard of it, never seen it, never used it. And I'll explain that here toward the end. But electroanalgesic therapy a lot of people would say, oh, it looks kind of like a TENS unit. And most of you know a TENS unit is like a muscle stimulator, like an electrical stimulator for muscles. The difference is exactly that. A TENS unit is muscle stimulator technology, and an electroanalgesic therapy is a neural stimulator. It's a very different technology, right? So what happens is the electrical current at high pulse will depolarize the pain neurons. And what that does is it inhibits the pain signals to the brain. So you're experiencing this basically this pain transmission is inhibition, which is actually de-escalating that inflammation, that pain and inflammation cycle. Most doctors out there understand this and they'll explain it to patients. You have a pain issue, which triggers inflammation, which triggers more pain, which triggers more inflammation, and this ongoing cycle. And it can get worse. And one of the primary aspects of pain management and in the pharmaceutical industry in general, they're trying to figure out ways to interfere with that pain and inflammation cycle. Let's find a way to get rid of the inflammation, and then we can actually reduce the pain and things like that. So that's a huge part of this ongoing chronic pain issue, is this cycle. Electroanalgesic therapy is excellent at reducing inflammation and reducing the pain. So the high pulse electrical current also stimulates the release of neuropeptides and neurotransmitters, endorphins, enkephalins, and GABA. All of these combined, they make you feel very good. It makes it feel like a lot of people will liken it to maybe like a runner's high, or like the way you feel after you work out. You feel just good, kind of, I feel really good today, because I worked out this morning or something like that. That's how the treatment makes people feel typically. And those neurotransmitters are a big part of that. So you got rid of some pain, and you also have that the enkephalins, endorphins, and GABA running through your system. So you do feel pretty good after the treatments, and that's contributing to the overall pain relief outcome. So another question is, well, how long does it last? And I'll go into more details on that in a moment here. But the treatment it's a cumulative effect. It is the reason we have this program structured as a 1 hour treatment twice per week for 8 weeks. Why is it structured that way? Well, a single treatment, the electroanalgesic therapy by itself, it will produce a couple days of outcomes. So if you got a treatment with it and you feel pretty good, typically that will last for a couple days and that's it. And if you want to have a long-term outcome, you would need to do it on a regular basis for a period of time, twice a week for an hour, each time for 8 weeks. And if you complete that 8-week program, our expectation is for you to go somewhere 3 to 6 months of ongoing relief. So wherever you ended up at the end of the program, 3 to 6 months is where we're aiming for you to stay out of pain for that long. A lot of patients end up longer than that. And I've had lots of patients that end up, 6+ months. I've talked to several patients who have had over a year of success and relief on this. So after finishing the program, lasting a year longer. So that being said, that's the electrical therapy part of this, and it works amazingly well. And again, this is being offered in your home, so you don't have to get out and go to the office for it. So the second component of the program is an IV nutritional hydration. Most patients are, chronic pain patients. They are also chronically dehydrated. They're also chronically nutritionally deficient. So that is a perfect avenue to introduce this very simple IV system into the treatment program. Vitamin mineral mix in that IV. And it does have an amazing synergy effect with the electrical treatment. So you'll have the electrical therapy, and then the combined IV therapy will actually produce better outcomes, faster onset of outcomes, and in longer durations. And that's what we've noticed over the years. Again, just asking the patients, talking to the doctors who've worked with the program, getting their opinions on it, and how adding the IV definitely helps patients get better faster. All right. And the third component of this is health coaching. A lot of people are thinking, okay, health coaching, I don't need health coaching. I know I need to eat better, eat vegetables and get sleep and drink water, right? And that's all you have to do for health, right? And go for walks, right? But so there's a lot more to it than that, though, that you do want to actually talk to the nurses and do the health coaching. Here's what I've noticed over the years. What's interesting is that the patients who've been in chronic pain, if you're watching this video and you're in chronic pain, then you probably know what I'm talking about here. You're in chronic pain, and there's just not as much motivation to try and be healthy at all when you're in chronic pain all the time. And the only thing that people are telling you when all the medications are worn off and all the other options are not available, they're saying, oh, we should just try being healthier. Just try eating better, try being healthy. Okay, that's great. That's something that will help me. If I started today being super healthy, maybe that will help me months from now, right? But I'm in pain today, right? And that's one of the hard aspects of dealing with chronic pain, and just somebody telling you to just go be healthier to get out of pain. It's very difficult to engage in that. And I've known, plenty of people, plenty of doctors and people who've tried to create, pain treatment programs based off of just being healthier. And yeah, people can actually, have a lot of success in getting out of pain by just eating better and healthy or whatever. But if you're in daily chronic pain, that's very difficult to even care about. You're like, I'm in pain right now. I don't have time to wait for 6 months for this to work. So that being said, when this treatment starts working and you're getting out of pain, there's a light at the end of that pain tunnel. Suddenly now you can see it working. You can see the pain being subsided, and you're like, okay, I'm getting out of pain. I think I would love to start eating better, start getting more exercise, going for walks. I would love to start doing everything that I should be doing for health. And that's what the nurse is going to work with you on. At each of these treatment events, you'll get a small health coaching visit with the nurse. And she'll go over, she'll set goals with you, go over things with you as a health coach. And it's pretty exciting to start working on all these health activities with the patients. The nurses like doing that as well, but you as the patient would definitely benefit from working with a nurse on this. And again, motivation is a 180 on motivation. The moment you start getting out of pain, everything starts getting better. Right. So those are the three things: electroanalgesic therapy, IV nutritional hydration, and health coaching. And so what's the success rate of getting out of pain in this program? All right. So across the board, talking to all the doctors out there who've worked with this program, The average that they all agree on is 85%. And I've talked to several doctors who would say that sounds about right. 85% of the patients that go into the program are achieving a greater than 50% reduction in pain. So that's what, again, most of the doctors working with us on that have estimated that from their own estimation from working with patients in the office. Some conditions actually have had better success rates, and they'll tell us that too. Like, what could you identify if there's one condition that seems to have a better response rate, better outcomes? Oh yeah, typically it's neuropathy, fibromyalgia, and there's a couple others where the doctors are thinking, oh yeah, actually probably better than 85%. It's probably more like 90 to 95% of patients coming in here with peripheral neuropathy end up getting out of pain, greater than 50% relief of the pain. So yeah, well, that's an amazing outcome. That's so much better than almost everything else out there. And if I could talk to you as a patient or as a just a someone listening here, and I just said, okay, your options are going to be medications, surgery, or implants, or invasive procedures on a regular basis. Or you could do this one thing where they come out to your home and treat you on site, and it's non-invasive, not non-pharmaceutical, non-invasive, non-surgical, non-chiropractic, and we're going to come out to your house and do it there. Which one would you pick? Out of all those other options, which one would you pick? And hands down, the patients will always, when we've been in these offices, always say, oh yeah, I'd pick the one where the neurofunctional pain management one with the electrical therapy. I'll do that, right? And so that's what they would want. And again, now I will say this though, all of these other options I just mentioned, they all have their place. And I'm not trying to say that they're bad. I'm just saying, a lot of people don't want the medications or they don't work anymore, right? So that's just an option that just it can be an option, and sometimes it is an option, but sometimes it's just not even worth trying if the medication is not even working anymore, right? Or if you don't even want to get on it. Or in today's world of opiate issues, no one wants to start down that path on opioids, right? So avoid the meds. Surgeries, some people aren't even eligible. There's very coin toss, if you want to call it that, coin toss on if the surgery will actually help you or not. I've talked to a lot of patients where those surgeries intended to relieve pain did not work at all, and some of them actually made things worse. And I've talked to a few where it actually helped. So surgeries, I would say, at best a coin toss or a dice roll on those outcomes and successes. And invasive procedures, you're looking at spinal injections and ablations and all those little things like that they do. So I've seen lots of people have success with those, but at the same time, a lot of those are temporary. They have to be done on a regular basis, and then they actually start losing efficacy as well. So after a while, they start to actually not work as well. And most of those end up being, the injections are typically steroid injections. And again, you can only have so many of those a year, under the guidelines of how much you can have. And then a lot of those actually start having, they wear off as well. And of course, there's all this research showing now that, ongoing routine steroid injections use are actually harmful over time. So a lot of that stuff is being shown to be not the best idea for everyone. It goes right back to what can we do? Well, we can do this. We can do neurofunctional pain management, and we know it works. So let's do that. Covered by Medicare and commercial insurances. And that's another question we always get. So if you know it works and the nurse will come out to your home and do it there, then why wouldn't you do it, right? So that's a very simple answer for that. So now we know it's the RELATYV Mobile Pain Treatment Program. The nurse will come out to your home and treat you on your home. It's 1 hour per visit, twice a week for 8 weeks. That's the program. We are anticipating, as on the whole across the country, anticipate patients to be about an 85% success rate across the board with all these different pain conditions. It's not just neuropathy, but today that's what we're talking about here. That's what we're anticipating for everyone, and we're aiming for a 3 to 6 month duration of outcome for everyone. A lot of you will probably have a much longer outcome than that. So how do you do this? First step, I've got a link here in the description of the video. You can go straight to our site. You can fill out the insurance form to just see what your benefits coverage is for this. Our team will jump in and take a look at that for you, reach out to you and let you know what things look like for you on the insurance side. We have a nurse. I hopefully have a nurse near you. Not everyone watching this will have a nurse very close to them, but a lot of people will. And we are always growing. We're bringing on nurses all over the country. And so they'll likely soon, if not already, there will be soon someone near you that can actually offer treatment. So I encourage you to reach out to us, talk to us, read about this. connect with us, and let's hopefully we'll see you soon. Thank you so much.